Well, new this morning, the coronavirus has hit communities of color especially hard. Experts say that a history of medical mistrust could prevent African Americans and Latinos from getting vaccinated. Dr. Jewel Mullen is the Associate Dean for Health Equity at the Dell Medical School at my favorite campus, the University of Texas in Austin. And she's joining us this morning to talk about the safety of the vaccines that are being produced and what's being done to encourage people to get these shots. Thanks for joining us today.
Thank you for talking with me.
Absolutely. Can you just briefly explain, when we talk about this history of mistrust, what specifically has created this mistrust for people?
The history of mistrust comes from lots of sources. The one that we talk about the most, I think, would be the legacy of the Tuskegee experiment. But I would say it also goes beyond that. For example, over decades and for centuries, African Americans, and this has been well documented, have been subjected to medical experimentation, treatments that they didn't even know were going on, and treated in ways that in many circumstances reflected that members of the healthcare community didn't really see them as necessarily fully human. If you consider then that part of what we uphold in medical care is that people need to have informed consent, informed decision-making and shared decision-making, now as we're going into this massive communication around the coronavirus vaccine, we have a tremendous opportunity to do better than we have ever done before.
And it's important because we know, Dr. Mullen, that coronavirus has disproportionately affected certain communities. So what is your message for people right now?
So there are a few things that I've been telling people, one of which is I'm not going to assume what people might be worried about. So please, instead of just saying you don't want a vaccine or you're not so sure, get your questions answered. Lead the conversation by getting your questions answered. 2, stick with reliable, accurate, science-based information. 3, my shorthand today is vaccines were developed through science, not through science fiction. Don't be put off by names like warp speed or clinical trials. All of the steps along the way to assure that there would be a vaccine that is effective and safe have been followed.
With that last point, I hadn't really thought about that, but that's a really interesting way of putting it. Thank you for joining us. We appreciate it.
Thank you.